Thank you for joining today's important event. While we are discussing, and we will of course be discussing why youth should be concerned about AMR and the ways for young people to get involved in action on AMR. While we are discussing securing our future from AMR, a crisis is already happening today. A crisis of lost lives and livelihoods, medicines at risk, affecting food security and economies everywhere. This is why the World Health Organization has declared AMR one of the top 10 global public health threats facing humanity. That's worth repeating. The World Health Organization has declared AMR one of the top 10 global public health threats facing humanity, and why leaders are stepping up to take action and bring attention to AMR. We are graced with our host, Her Excellency Amor Mottley, the Prime Minister of Barbados and Chair of the Global Leaders Group on AMR, who will be introduced by the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, who has called AMR one of the most urgent health risks of our time that threatens to undo a century of medical progress. We will also later hear from two youth representatives, and we eagerly look forward to their interventions. Today, we will discuss the importance of addressing AMR and have the opportunity to answer questions submitted by our audience. So without further ado, allow me to introduce Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, for his opening remarks, and to introduce our keynote speaker, Dr. Tedros, Director General. Sir, you have the floor.
Thank you, Sherwin. And apologies, Your Excellency, Prime Minister Mottley, for I was rushing from another and limping. And good morning, my sister. And good afternoon and good evening to everyone joining us online, wherever you are in the world. It's an honor to have you with us. Engaging young people is a key priority for WHO on all health issues, including antimicrobial resistance. After all, it's your generation that will bear the consequences of how antibiotics are used or misused today. You're the future leaders, the future consumers, and the future providers of healthcare who will be most affected if we do not act with urgency today to address the AMR crisis. And you are the change makers. Your advocacy can ensure visibility and exert pressure on policymakers. Your activism on social media can help to educate, mobilize, and generate awareness of AMR. Today, we're honored to be joined by Her Excellency Amor Mottley, the Prime Minister of Barbados. As a global champion for AMR and chair of the Global Leaders Group on AMR, Prime Minister Mottley has demonstrated outstanding leadership on this issue. Thank you so much indeed. As the leader of a small island state, I have also very much appreciated Prime Minister's leadership on climate change, as well as on vaccine equity during the COVID-19 pandemic. Your Excellency, thank you so much for joining us for this very important discussion. We greatly appreciate your leadership and for taking the time to be with us today. Maybe one more thing, the Bridgetown Initiative is another addition. And thank you so much for your global leadership. And over to you, my dear sister.
Thank you so much, Dr. Tedros, and good morning, good afternoon, good evening, or maybe I should just say greetings to all. And thank you for having me here. As usual, whenever you call, I try my best to be here because your work is perhaps among the most vital on this planet. I'm here today to speak with all of you about what we've come to call the silent pandemic that our world has been facing for years. Antimicrobial resistance, or is more commonly called AMR, is complex, but its effects are very clear. Every year, AMR already contributes to almost 5 million deaths associated with drug-resistant infections. That is over 13,000 people per day. Even the most common infections we face today are at risk of not being treatable because of the resistance that has developed against medicines such as antibiotics. With increased resistance to medicines, the risk of disease spread and severe illness is growing at an alarming rate. The evolution and spread of AMR is accelerated by overuse and misuse of antimicrobials, inadequate infection prevention and control, poor waste management, lack of equitable access to medicines, and the discharge of antimicrobials into our environment. Sometimes the antimicrobials used in animals and plants are the same as those used to treat humans. So when they're not used responsibly in our farms, humans will also feel the impact. While resistance can develop naturally, the overuse of antimicrobials in humans, animals, and crops has accelerated, my friends, the process. So along with climate change, the climate crisis as I come to call it, AMR is one of the greatest health and development threats that we face. In fact, the climate crisis and AMR are closely linked. The changes in the natural environment due to the climate crisis are increasing the spread of infectious disease, including drug-resistant infections. There is now growing evidence that the environment plays a key role in the development, the transmission, and the spread of AMR. The same drivers that cause environmental degradation are contributing to AMR, threatening our health and our food systems. Pollution, my friends, is increasingly understood as a means of transmission of AMR. Excess use of antimicrobials and their release into the environment from sources such as sewage are also contributing to the problem of AMR. And as with the climate crisis, we are looking to the future, but already seeing the effects today. We're talking about AMR as a silent pandemic as if we're not already suffering its effects, as if it is silent. We are already in a crisis. This is no longer a silent pandemic. Like the climate crisis, we have been slow to act. We've been slow to respond, even though we have all the evidence. We need to bring AMR to the highest political level. And also we need the message to come from the people, from you as young people. We need to catch up. Like the climate crisis, the responsibility to act and the consequences of inaction do not always fall equally among the global population. Those who have been emitting the most greenhouse gases are not those who are suffering the brunt of the climate crisis. The devastating weather events, the hurricanes and the droughts, the food insecurity and the disruption to drinking water supplies. And my friends, the burden of AMR disproportionately falls on poorer communities where medicines are already scarce, where health and hygiene infrastructure are not sustained, where clean water is not freely available for drinking or for hand washing. These are the injustices across the climate crisis and across the AMR crisis and across the global financial system, which requires transformative change. These injustices are why I've called for reform of the global financial architecture and for development financing to be equally reformed. The way the world does business must also be reformed. The injustice of the countries faced by the countries in the global south being at the mercy of others in the global north for financing, for climate mitigation, for health systems, for AMR. These injustices, my friends, are why I'm speaking with you today. And truly, as Mahatma Gandhi said, the change starts with you. As AMR continues to spread, the impacts on economies, on lives, on livelihoods are expected to be significant and devastating, particularly for low and middle income countries. But you know what? We have the tools to prevent and mitigate the AMR crisis, and prevention is critical. We also have education and information, and we must use the existing antimicrobials wisely in humans, in animals, and in plants. We're also building surveillance systems for drug resistance, and we must continue to support and improve them. And we need strong health systems to prevent infection and prepare for the AMR response. But what we need most is the political will and the resources to bring these responses to scale around the world. What we need is a movement. What we need What we need is the social change and activism to bring attention to this crisis. We need a mass social movement to popularize the fight against AMR. We have to give faces and voices to the vulnerable, to the unseen, and the voiceless, because so many have suffered from the consequences of AMR, and so many who have lost their lives are not here. Obviously, those who have lost their lives are not here to speak out. We are trying to safeguard our health and our medicines, but already people are dying and our medicines, regrettably, are not working. We are in a crisis today, which demands for all people, and especially you young people, to raise the awareness and to take action. With action and momentum on AMR, we are where we were for climate action 20 years ago. We need to build a movement, and we need to rise to the occasion. We must keep building and keep moving forward. And I'm sure that many of you know people who have already passed as a result of this unfortunate pandemic. As much as we see what feels insurmountable around us,
please try again.
As much as we feel and see what is insurmountable around us, we must make the choice to act, and we must use our power to change. We need to rally people to understand the consequences of inaction. Those of the status quo needs to be able to understand that it can't remain. Those consequences are deadly, and truly our lives will be at stake. And that is why I chair the Global Leaders Group on AMR. And that is why I talk to you now today about it. And wherever I go, in every speech I can, I speak about AMR. The Global Leaders Group prioritizes political advocacy and brings attention to AMR to political leaders around the world. We urge them to take action to prevent AMR and to mitigate its impact. Indeed, the United Nations General Assembly high-level meeting on AMR next year in 2024 is a critical opportunity to further accelerate a global response to AMR by having heads of state commit to taking action. What we need now are specific commitments and resources to achieve them. Attention to AMR is in fact growing, as it should. But our present and our future don't have to be at risk. You, young people, play an important role in spreading the word and mobilizing action on this awful silent pandemic. I always appreciate talking with young people because it gives me hope. It brings me joy to see your actions inspire more action. It moves me, truly, to see your words inspire others, because you are the future generations. You should be the ones with the creative ideas and the energy to shape our present for a better future. I'm asking you, therefore, to use your voices to talk about AMR. Use your voices to raise awareness among your peers and your colleagues, among your parents and your grandparents. This is the first step in advocating for action. Start with the community around you. Make sure we use antibiotics as they were intended. Contact your political leaders and call for action. I'm pleased to be speaking with the two guests today who are active on AMR within their student associations, and I look forward to hearing from them. No one can ignore the voice of our young people. It is your health, your livelihood, and our shared future that is at stake. And you all have a role to play in creating a safer, more equitable, and more prosperous world. You have the power to move the needle, to create meaningful change. I thank you for your attention today, and I remind you where you are able to use your capacity to choose, your capacity to change, and truly your capacity to act. I ask you, therefore, to act on AMR. Make that definable difference. Make sure that you can save those lives that will be at risk if we don't get this right. I welcome you to join me in this movement. Truly, thank you.
Prime Minister, as always, thank you for those insightful remarks. You know, I always say that you're a journalist's dream. It's a journalist's dream listening to you because every sentence you find a soundbite. Let's just recap some of the key points there. This is a silent pandemic that the world has been facing for years. AMR contributes to around 5 million deaths annually. Overuse of antimicrobials has accelerated the threat. Climate crisis and AMR closely linked. Key point there, pollution is a means of spreading AMR. We are looking to the future, but seeing the effects today. We are already in a crisis. We need to bring AMR to the highest political level. The burden of AMR disproportionately falls on poorer countries like many of the SDGs, climate change and so forth. We have the tools to combat AMR. Education is key. We need strong health systems, political will, social change, mass social movements. Young people need to build awareness. Use your voices. This is the first step in advocating for action. So clearly, Prime Minister, you have made clear that youth and younger generations can play a vital role in taking action to tackle this threat. We thank you for those remarks. I'm now pleased to welcome our guests, Ms. Audrey Wong of the International Pharmaceutical Students Federation and Ms. Karina Katik of the International Veterinary Students Association. And I'd like to open up a discussion and hear about your experiences with AMR and how it has affected your day-to-day life. AMR, of course, as we've heard, affects millions of people a year. Has it affected you, for example? Has it affected you personally? How are you working to address AMR? These are some of the questions I'm hoping you will answer for us today. So I'll bring in Audrey. Could you share how you relate to AMR and why young people should be engaged? If the Prime Minister hasn't made the case, then maybe you can help, right? And perhaps respond to some of the things that Prime Minister Mottley said here today. Please, Audrey, you have the floor.
Thank you, Sherwin, for the floor, and Her Excellency and Dr. Tedros. It's my pleasure to have this opportunity to share a little more from the youth perspective. My name is Audrey, and I'm currently serving as the Chairperson of External Relations of the International Pharmaceutical Students Federation. I'm also a young clinical pharmacist at a hospital, and throughout my practice, I have actually witnessed a lot of overprescription of antibiotics, such as prolonged duration of broader antibiotics being prescribed, even after an organism has been identified. In these cases, my role is to recommend narrowing or de-prescribing antibiotics. I also have had the opportunity to educate nurses as well as medical doctors on different drug-resistant patterns and our preferred medications. However, we do see that in some cases, when medications continue to be prescribed, it is unfortunate that we still see some AMR cases in younger patients, which really leave us with only 1 to 2 options for the rest of their life. And as an AMR youth advocate, I've also been working with other young leaders to raise awareness of AMR. And that one example will be our annual Global AMR Youth Summit, which is actually also happening in 2 days. In this summit, we really hope to highlight the impact of AMR on our patients. We also want to strengthen that multidisciplinary collaborations to combat AMR. In our organization, IPSF is dedicated to fight against AMR with other stakeholders, as we really understand that it is a multi-sectoral combat and we need everyone to address this silent pandemic, as Her Excellency has mentioned that it is still affecting millions of our patients every year. And we have also been involved in different consultations, as well as our policy work, such as a declaration on pharmacists' role in combating AMR. Currently, with over 113 member organizations and representing over 500,000 of pharmacy students and recent graduates worldwide, we are very dedicated on also advocating on AMR on a local and national communities through different campaigns and various initiatives. And as pharmacists and also pharmacy students, we are ready to combat AMR, as well as advocating for ways to curb AMR through better policies and regulations on OTC cells. So we are ready for this fight, and thank you so much for involving youth in this conversation. Thank you.
Thank you, Audrey, and thank you for your advocacy and leadership. Moving on to Karina, could you also share what made you care so much about AMR and how you are working in your organization with youth to secure our future from drug-resistant infections? Karina, you have the floor.
Thank you so much. So, hi everyone, I am Karina. I am currently a final year veterinary student here at the University of the West Indies. I'm currently also a trust member of the International Veterinary Students Association. So, honestly, my experience with AMR has been a learning curve thus far. I think with something so grand, there's just an influx of information that we need to keep learning. There's so many things that keep happening that we need to keep on top of. And honestly, being in this veterinary field, I have seen on a daily basis the way in which AMR affects us, especially in this food animal industry. According to our statistics, approximately 73% of antimicrobials are used in food animals. And I think it's such a it's such a point to really get out there, because as young veterinarians growing up, we're now a bit scared as well as to when we reach out into this world and we are practicing veterinarians, what is our position now if it is that we have so much resistance to certain antimicrobials? What is it now that we're going to do? With regards to my organization, the IVSA, they have been year after year just working towards, projecting why AMR is so important, why understanding the effects of it, and how we as young professionals can actually make a difference. I do agree with Her Excellency, and I do also agree with Audrey. This is such a joint effort. It's a group effort. We can't do this alone. It's not a veterinarian's job. It's not a doctor's job, not a pharmacist's job. We're all in this together. And I do believe it's not only, getting education out there and really having persons understand what AMR is and what is happening, but also what little they can do. Audrey mentioned the fact that you still see persons having an overuse of these antimicrobials, and it is still the same thing that we see happening even in animals. You see a lot of pet stores prescribing antibiotics to clients, and it stems from those little things. And doing the education is one part, but if it is that we also take the time as future veterinarians to sit down and actually, converse with our clients and actually explain to them how is it, overusing these antimicrobials. And if it is that a case comes up and they say, oh, this is very similar to the previous case, I'm going to use the same medications. I think that's where we need to really go a little further and actually explain to them, okay, no, this is not what we want to do. So I do think, in our future, we would really like to not only just push the education aspect, but also to work together with the other organizations in combating AMR. Thank you.
Thank you, Karina. And before I go back to Prime Minister Mia Mottley for her reactions to those interventions, let me just share with you the message from the President of the General Assembly in reaction to AMR Awareness Week. AMR is truly a global concern, a silent yet bigger killer than AIDS and malaria, causing 5 million deaths globally each year. You've heard that from the Prime Minister as well. And by 2050, it will be on par with the death toll from cancer. The spread of drug resistance is rendering medicines which we rely on to keep us safe and healthy virtually ineffective. This is even more concerning against the backdrop of climate change and environmental degradation, which are altering our ecosystems, fueling the spread of zoonosis, which I think goes directly to what Karina was talking about, and the spillover of pathogens from nature to humans. Its rapid spread is shifting more people into poverty. So AMR, very much, Prime Minister, part of the broader discussion around the SDGs. And we all know, I know you're the co-chair of the SDG advocates, the leadership advocates of the SG. Prime Minister, we are not on pace to meet the deadlines, and AMR might also be at risk, not so?
No, thank you. And the truth is that all of these things worry me. And that's why I want to pick up from where Karina was speaking with respect, that we are all in this together, and we need to be able to mobilize and to get that action collectively at all levels. I have personally dealt with AMR as it has affected my family, and again, recently close friends. And I have a great responsibility, as I understand it, as chair of this Global Leaders Group, to strengthen the political momentum and the leadership on AMR. And that's why anytime that the WHO asks me to do anything, I'm here for them on this. We have overused antibiotics and other medicines for years, and now people are dying of untreatable infections. The economic impact also is growing. And if we leave this unchecked, trust me, AMR could push up to 28 million people into extreme poverty by the year 2050. Now, we're supposed to be reducing poverty, not adding people to the poverty statistics. We need meaningful support, financial support for national AMR action plans and financing to address the crisis, as I said, in antimicrobial research and development. We had 20 companies doing research in the year 2000. We now have 4. We simply do not have enough new medicines or diagnostic tools in the pipeline. And of course, there's a lack of infrastructure for proper infection control, potable water, and for waste management. All of this allows the AMR to spread, as I said earlier. So my friends, this lack of equitable access to affordable and quality antimicrobials and vaccines and diagnostics, I spoke about yesterday in my own country. And there cannot be first-class and second-class citizens anymore in the world. These are issues that we have to tackle through the Global Leadership Group. But I also believe that we're only going to get the needle to move, the political action, when young people call on our governments to take action. And why? The truth is that you are part of the electorate who can demand the future that you want to live in. And you're the ones who, if we don't check this now, will be the biggest victims of it all. So I hope that this is the first of many events that will help to strengthen the engagement with our young people. From the very beginning, I've said this is where the action must lay. Thank you.
Prime Minister, before I go to a video that'll represent some other youth voices, talk a little bit about the debt crisis facing countries, particularly in the developing South, right? So when you tackle the SDGs, there's a very interesting statistic out of the UN that says some countries pay more on their debt repayments than they do on healthcare or on education. I mean, it's extraordinary. Yeah. It's an extraordinary statistic to see. How do we need to turn this cargo ship around so that we can spend the money where it really needs to go, the most?
We've been foisted into this situation in a worse way because of the poly crisis. Countries have had to look to spend money to come out of the pandemic of COVID-19. Countries are responding in many instances to the climate crisis. And I call the hurricanes and the storms the heart attacks of the climate crisis, but the droughts and the coastal degradation are the chronic NCDs. So people don't see that every day, but it is yet having an impact on our communities and on livelihoods. And therefore governments have to spend. And when you start to disaggregate where the debt has been built up, you begin to understand that in many instances, it is not as a result of our own making. Now, when that debt is there and you have limited fiscal space, then you can't borrow to be able to do education transformation easily. You can't borrow to do the beefing up of your public health systems or indeed access to general health care for your populations. And what this does, therefore, is to lead to a cycle of underdevelopment and an inability to bring people out of poverty. We have asked over and over that there be a recognition that we need longer-term debt and cheaper debt. And that if you look and see what it took for countries like Britain and Germany to get out of deep problems in the last century as a result of wars, that they were given the space to be able to do so and to rebuild their societies by being able to access longer-term debt. Britain took 100 years to repay the debt from World War I. Germany was given the ability to cap its debt service on 3 to 4% of its exports, so as to ensure that there was not imbalance as it sought to be able to navigate its way into the reconstruction while repaying its debt from what it had incurred to fight the war. So we say today, look, we need to be able to look at what is truly debt sustainability. Every dollar of debt is not the same. We need to be able to look and recognize that we can't build schools and hospitals with 15-year debt easily while doing the other things that we need to do. We need 30, 40, and 50-year debt. in order to get through this unique moment. And the world isn't always going to be here. We know that we go through these peaks and troughs. But at this particular time, when the polycrisis is there, when it has been compounded by war and inflationary impact, when it has been compounded by disruption in supply chains, these are the things that are now putting development potentially on pause. And that's why the debt pause clauses are so important, because it allows us to pause the payment of debt if a crisis in the climate happens for 2 years, and allows us then to focus on beefing up the health systems and to making sure that there's the potable water and making sure that there's minimizing of infection, so that we don't end up losing people who should not be facing death because of a lack of capacity of governments to take care of them in the most basic of ways, come with sanitation and infection control.
One more before I go to the video, Prime Minister. Talk about the moment we're in. We very recently in September had the high-level gathering of leaders. You were here at the UN General Assembly in New York. There was a big SDG summit. There was a political declaration on that. There was a political declaration on pandemic preparedness, universal healthcare coverage. We left New York. People left New York in September with a lot of momentum and a lot of wind behind their backs, and then boom. Literally, Gaza happened. So I wonder, are we distracted? Can we do both at the same time, or do these wars need to come to an end, and how do we get there?
Well, the regrettable thing is that it is what it is. We've seen wars in Ethiopia, we've seen wars in Sudan going on, we've seen wars in Europe, we're now seeing wars in the Middle East. The truth is that we want the wars to come to an end. As I've said over and over, the longest war in history came to an end. And we know that peace will come. The question is at what cost and with what damage and with what loss of life. Having said that, we don't have the luxury of doing other than walking and chewing, because as we are doing these things, other damage is accumulating. Yesterday or day before, a number of people died in the Dominican Republic from floods. And I can almost pick every week. We this week have seen that our temperatures have gone over 2 degrees for the first time above pre-industrial climate. And what is worse is that for 1/3 of the days we are hearing of this year, we have had temperatures over 1.5 degrees, and we've seen the evidence of it. So we don't have the luxury of pressing pause while the wars come to an end. We want peace, for sure. But we have to continue the battles. We have to continue to walk and chew. We have to continue. And these are the easy ones. When we say, look, give us longer term debt, give us cheaper debt, that's easy compared to trying to stop a war where the two sides are invested in trying to pursue what they think is their legitimate right to defend themselves. So I really do believe that the war should give us context, and the war should cause us to recognize that we really need to deal with it. The truth is that the ultimate war against the planet and against the loss of biodiversity is the one that is going to give us the greatest difficulty in securing victory. So let us fight and win the battles along the way that we can. Let us win the battle for debt. Let us win the battle for development. Let us win the battle for the elimination of poverty. And let us secure the peace that comes from dialogue. Because without dialogue, people are just going to stay on the course that they are.
Yeah, great intervention. Thank you, Prime Minister. And I think the broader point is that we need to walk and chew gum at the same time. But you certainly will not be dealing with AMR in the context of Sudan today. You won't be dealing with AMR in the context of Gaza and many other conflicts around the world. So we really need to stay focused on what is important in terms of the broader global development agenda. All right, I've been prefacing this video from youth representatives now for a few minutes. Maybe we should watch that. So thank you for the conversation so far. Let's hear now from few perspectives on the role youth are playing in addressing AMR. Let's watch the video now.
Stewardship and individual behavioral change are main global strategies to reduce resistance.
First is use antibiotic responsibly, and secondly, spread awareness through education and campaigns.
We can lead by example by appropriate antimicrobial use at our homes.
My health is my wealth. I care about AMR because I'm desirous of securing a healthy future for myself, my family, my friends, my community, and future generations.
Addressing antimicrobial resistance is important to me. so that our children can continue to rely on medications to treat common infections.
The reason that I care about antimicrobial resistance is because the discovery of new antimicrobial resistant organisms far outpaces the discovery of new antimicrobial drugs. This is a global issue that will affect everyone, and it is important to take a global perspective in solving this issue.
We can work towards securing our future from AMR and ensuring effective treatment options for bacterial infections. Thank you, everyone.
So some of the audio there might have been a bit low for you, depending on where you're watching and listening from. So just worth repeating some of the messages there. Stewardship and individual behavioral change are main global strategies to reduce resistance. First is use antibiotics responsibly, and secondly, spread awareness through education and campaigns. Exactly what the Prime Minister has been talking about, this mass mobilization that is required. We can lead by example by appropriate antimicrobial use at our homes, in our homes. My health is my wealth. I care about AMR because I am desirous of securing a healthy future for myself, my family, my friends, my community, and future generations. Addressing antimicrobial resistance is important to me so that our children can continue to rely on medications to treat common infections. I mean, that's a really great point there, Prime Minister. Your reactions to some of those interventions?
Look, it is clear that young people really do care about addressing AMR, and they should. I see the energy and the momentum as we talk about it more and more, especially when you tell them, look, going to the dentist or having a baby may well become an event that could threaten your lives in a way that it wasn't for your parents and grandparents in the last century. I hope that therefore we can seize the opportunity to connect and to engage and to act. Taking action at home, you can use the antimicrobials wisely and dispose of them properly. There's simple actions that we can take that can make that difference. And we can talk about them with our colleagues, with our friends and our families. You can share them on social media. I recognize the passion that they have. And I want to say to you, young people, that your passion for your health and your future, you are taking responsibility for that when you act. Everyone has responsibility in addressing AMR. But sometimes you may have to be the ones carrying them and showing them why it is important. It can be as simple, as I said, as raising awareness for them of the threat to AMR, to humans or to animals or to plants, to environmental health. Because most people, even if they get it for humans, they don't understand the link with animals, with plants, or with our environmental health. We all want a future with effective medicines. And really, this is a global issue. And there's a major gap to fill with the antibiotic pipeline and the access crisis that we are facing. And I've said to you what is the problem with research and the numbers of companies coming to work every day to do it. We have to start thinking of antibiotics as a global public good, because the economics of antibiotics doesn't work for a lot of the pharmaceutical companies. And therefore, that is going to mean that we have to be able to see how we can guarantee funding for the pipeline of research, because you use antibiotics for 7 or 10 days, but you use other drugs invariably for months and years. So look, this is a global issue, and these faces and voices are just a segment of the motivated and activated young people around the world. And there are so many more, but we need so many, 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 many more on top of you. We cannot address this alone. This has to be a mass-based movement. It can't just be something that a few of us get together in a room or in a teleconference and speak about. So happy to see you all engaged and inspired, but let us expand the numbers, because without numbers, we are going to see too many people becoming victims as we go forward. This is your movement. Just as climate is your issue, this has to be your issue. And there are older people who are simply going to say, oh, I'm not sure, I don't understand, blah, 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 blah. You don't have that luxury, because, as I said, it hits home. And if you take the time to work out, when last did you see somebody die of a hospital-aided infection? Or when last did you see somebody go into the hospital and the drugs just didn't work and the organs start to shut down? Well, for me, it was as recent as a close friend 2 weeks ago. So this thing is real, it's constant, but it can't be won by a few good people. It has to be won by the majority of the world saying enough is enough. There was a time when people didn't think, Dr. Tedros, that we could stop people from smoking. I am a reform smoker. I didn't think that I would stop either. But the message got home, and you know who made the difference with me? My nieces. My nieces coming after me over and over and over. And I said, look, this just isn't worth it anymore. And if medicine that I will have to end up going on and the risk of disease, cut it out. So
Prime Minister, make the
let's do
link. Please make the link for us, right? You've talked about this mass movement that is required, but you've also talked about the catalytic nature of political will in this conversation. What is the thread that moves from mass movements to holding our political leaders accountable? What does that look like? Tell them.
But let's look back. When have we seen the greatest action on climate? When it became a mass movement. The issue of
Thunberg
climate
comes to mind. Greta Thunberg. Yeah.
Exactly. And all the young people across the world who stood up and said enough is enough. But the reality is that the science surrounding climate has been there for, my advisors tell me, from the 19th century. Okay? And the dialogue started to gain momentum probably in the post-1980s, 1990s. Al Gore's Inconvenient Truth was seen as this documentary that was out there, and a lot of people who were policy wonks knew about it, but it was not among the average household and the average population. Last night I met my citizens in a town hall meeting, as I do every month, and I started to make the point, everybody's complaining about the potholes in the road. And I said, but if you have 2 months of incessant rain coming at paces that we're not accustomed to, intensity that we're not accustomed to, then these things will happen. And at the same time it's happening, it's stopping the men from doing the work of repairs. And therefore, this is the way in which it is getting into the psyche of people. When they realize that there has to be restrictions on the distribution of water, that's because a number of countries are facing drought, whether here in the region, like my own country in the first part of this year, or in Kenya and other parts of East Africa, where it is truly at monumental proportions. So these are the times when, regrettably, when it starts to be accepted by the population, is already when it is beginning to be too late. We are trying with AMR to say, don't have to wait like what has happened with the other crises. Let's get ahead of it, and let's be able to recognize that by our individual actions and changing our behavior, we can, in fact, do the things that are necessary. Let us find the financing of this as a global public good, because the economics of antibiotics, as I said, just doesn't work.
I will say that if the COVID-19 pandemic taught us anything, it's that we need to get ahead of it, right, Prime Minister? So as our time draws to a close here this morning, this evening, or wherever you may be, I would like to take the opportunity to ask our interlocutors, Audrey Wong, Karina Katic, for your final remarks before we go back to the Prime Minister for closing remarks. So I'll start with Audrey Wong. Take about 2 minutes to give us your feedback now.
Yeah, thank you, Prime Minister, for such inspiring words. And I totally agree. We cannot wait until we are all ready enough to combat this AMR. It's going every single day that a lot of patients are on antibiotics. So really the time to act, it's now. And what we want to see, it's more actions from the young people, as well as different collaborations with different stakeholders. And I see that there are a lot of discussions such as climate change, and this is why we also need to also raise the awareness of AMR to make sure that everyone can also, not only just for health professionals to work on our side, but for everyone to contribute to this battle that we all have. And we are ready to fight for this, and then we are ready to work together to create a safer world as well as a future that we all want. Thank you.
Audrey Wong, thanks for that intervention. Karina Katic, your 2 minutes.
Hi, thank you so much. So, from this entire video, I think this beautifully captured the message that AMR is a global fight. And, they have mentioned such simple, small actions that we all can take to just combat the issues of AMR. Excellency, you spoke beautifully, and you really have inspired me as a youth to really do more in the field of AMR and to really go forward and make that extra step to now let's do some more research. Let's actually go further than what we've already know. I think us, the youths, we have a world filled with information and opportunities to work together to fight against AMR. And, you know, Audrey rightly said it, right now is the time for us to do this. We cannot wait anymore. We've waited so long, and it's really for us to work together now to, you know, do what we can. So thank you so very much for your words. It truly was inspiring. Thank you.
Prime Minister, before I come back to you for final remarks, let me just read you a little bit about what Dennis Francis, the current president of the General Assembly, also said in his statement. You, of course, mentioned earlier the high-level meeting that will be happening in the General Assembly in terms of AMR next year. He says we need to work cross-sectorally to preserve our ability to prevent and treat human, animal and plant diseases and to minimize the risks of spillovers. We need to reduce the risks for food safety and security, considering the high volume of antibiotics being used in the agri-food system. Huge issue. We need to implement our commitments to achieve universal health coverage and to achieve health for all, especially through equitable access to medicines. And we need to double down on our commitments to protect the environment, especially biodiversity loss, and ultimately to achieve the Sustainable Development Goals. Prime Minister, I'm going to give you the last word.
Thank you, and the others said it. The time for action is now. My role and my colleagues' roles as heads of state and heads of government is to take action to create a healthy future for all of our people. We have to pay attention to the inequality in our world, with some people not having access to effective medicines to treat infections. As I said, there can be no first-class or second-class citizens. Simply talking about AMR will only have meaning if we follow up with action. Please ask for action from your governments and find out what action your governments are currently taking to tackle antimicrobial resistance. You can start a grassroots movement with your peers, emphasizing everyone's human right to a healthy life and to healthy food and to effective medicines. You can write to your local political leaders requesting that they raise this issue with their heads of government and their heads of state. The momentum and the awareness of AMR is building, trust me. But we have to seize this time and opportunity to make sure we can carry it even further. We have a responsibility as global citizens to take action for our present and indeed for our future. We have to use our medicines responsibly and appropriately. By raising the awareness wherever we can, by talking to our friends, our family, our teachers, our governments, we are urging them to act as governments in a way that we can advocate against global action against AMR. We have to have the financing for AMR related to research and development, as I told you, including access. And as we move forward, we have to emphasize the links between the global climate crisis and AMR, because higher temperatures and other climate changes profoundly affect the course of many diseases. And increasingly, extreme weather events accelerate the spread of drug-resistant infections. I call this the season of superlatives: the hottest, the wettest, the coldest, the driest. All of these things will have implications. But we must also advocate for that political action to address the environmental dimensions of AMR. They are among the greatest challenges these, trust me, we will face in our time. I'm going to be urging political leaders to commit to clear targets and practical steps when we meet in the UN General Assembly next year in 2024 for our high-level meeting on AMR. And trust me, I look forward to seeing the actions that you will take, and I stand to support you in building this movement, what must be a mass-based movement to fight AMR so it does not move from being the third largest killer of human beings today to being the #1 killer, as is anticipated, if we don't course correct. So let's do what we have to do.
An additional note, Prime Minister, on that high level is that it is co-facilitated by Malta and Barbados. So we appreciate your leadership on this issue, and we look forward to your interventions at that meeting next year.
And I want to thank my co-chair, Chris, who does perhaps a little more heavy lifting than me on this matter nowadays. So he has been there to help spread that movement as well. Thank you.
Thank you, Prime Minister, and also our thanks to Audrey Wong and Karina Katic for their interventions. We, of course, appreciate hearing from the youth representatives that shared their voices in that video. And I thank you all for this action-oriented summary and a really interesting discussion. I hope our audience will come away with as much new knowledge and motivation that I have, and certainly go forward and implement. The Prime Minister said she needs a mass movement for this issue. We need a mass movement for this issue. Talk to your political leaders. Don't let them sleep easily at night. From all of us here in New York and around the world, thanks so much for joining us. Goodbye.
Thank you, and thank you, Dr. Tedros.
Thank you. Thank you very much. Thank you.
Take care.
Thanks, Dr. Tedros.
Thank you.
All right, thank you, Haley.